Hi, I'm Jason Kehoe from JK Therapy, Sports and Injury Clinic. The type of clients that visit me can be divided into two camps. Those that have general related pain and injuries from everyday events, you guys should watch the video on the left of the page here. The other camp are sports people who are training heavily or have sports related pain and injuries. This is a video for you guys. It's a little bit long, but I promise it'll explain my methods and thinking in a straightforward way. So firstly, please know that you don't have to be an elite athlete to suffer pain and to be deemed worthwhile to receive professional treatment. If you haven't had this type of work done before, I like to explain everything as I go along anyway, and I'll even coach you as we go along on how to do your own soft tissue maintenance for your issues at home. I've been involved in a variety of sports and coaching for well over 20 years now, from club level to international level, and I know how hard it can be to get the answers, the treatment, and the coaching to keep your body as pain-free as possible. We're all looking for a magic silver bullet at times. To keep you in top condition, we offer deep sports massage, which is really useful during tough training and especially when competition is coming up. During my own heavy training phases, I'm a fan of getting a good deep rub every few weeks to keep the body ticking over nicely. In my experience as an athlete, coach, and therapist who's traveled all around the world, expert hands-on physical therapy work is extremely difficult to come by. And I'm a big believer that this type of work is the most effective therapy for maintaining an athlete's body and getting you back from trouble. Well, I see many different types of injuries, but there are two main categories of sports injuries that I deal with here in the clinic. So you have trauma injuries where someone has suffered an impact or a fall, or some part of their body has literally broke, tore, or ruptured. Now, these are devastating injuries. These type of injuries bring their training and competition to a sudden and a complete stop. And not only that, but it's likely affecting their work and daily life greatly. These clients usually visit me post-surgery and have already been through a battery of medical tests and initial rehabilitation from their consultant orthopedic surgeon. Now, what is sometimes not done, and it's essential, is to figure out how they got into this situation in the first place. For example, was it technique related? The other far more common category of sports injuries I see usually start out as what we call niggles. When these niggles get bad enough, it usually forces them to take time off and to let their body get back to normal by itself. Now, these niggles can sometimes be managed with foam rolling, backing off training, cross training, but there's no doubt that they are bothersome and interfere with the person's training and sport. After all, what runner wants to be forced to swim, and what swimmer wants to be forced to ride a bike when that's not their main sport? Those that don't listen to their body and try to push through pain are usually punished with a far more serious injury and a longer layoff. Remember, it takes typically 6 weeks for the body to heal by itself. Most sports people, runners especially, fall into this category, which can lead to stop-start training. They tend to be inconsistent in their training, and they can never seem to increase their workload or their mileage without mysterious injuries popping up. For any successful sports person, consistency in training is one of their secrets to success. Firstly, a golden rule for you. Healthy muscles shouldn't be sore to press on or to rub. When you injure yourself from a fall, a slip, or a sudden and unexpected movement, the muscles involved become very tight and develop what we call myofascial trigger points. These may feel as knots in the muscles to you. They also happen when muscles are overloaded or misused. These now tight muscles will restrict your movement by pulling on a joint in your body, such as the knee, the ankle, the hip, or the shoulder. And the muscles are often very sore or tender to press on or to move. These trigger points can mimic everything from Achilles and knee pain to a sore back. And although you may feel like you have pain in or around the joint or tendon, in my experience, 95% of the time, it's caused by the tight surrounding muscles to that joint. My job as a neuromuscular therapist is to use a variety of precise pressure and massage, as well as many other techniques to encourage these knots to release and restore muscles back to their healthy state. Listen, I tell every athlete who doesn't move optimally, rubbing the problem out of the muscles is just like taking a painkiller. It will get you over the niggle or the injury hump, but if you keep moving incorrectly in your sport, in your daily life, they will likely be back again on my plinth. I don't encourage any athlete to become dependent on the therapist, myself included. So, the $1,000,000 question is, why did the injury happen in the first place? So this is where biomechanical assessments and mobility tests can come in. Harmful movement patterns are identified, they're eliminated, and we put in new and better ones. Then when we do this, the muscles will be happy to perform pain-free. If you are experiencing pain while running, we can do our running technique assessments here with you to see if there are any gait issues which are likely responsible for your pain. And unique to us here, not only can we identify the likely reason for your injury, but we know how to coach the offending movement out of you. You can expect to see an improvement in pain levels after just one session, and depending on the type and severity of the injury, we generally expect to see lasting results and return to normality after just a few sessions. So please feel free to call the clinic or email me before you book to see if I can help you with your particular pain and injury. Bye for now.